Do you have foot drop syndrome? Have you seen several videos about how to improve foot strength, but haven't found anything about how to relieve neuropathic pain? Well, this video is for you. In addition to loss of strength, an injury to the sciatic nerve in the gluteal region, for example, or from a herniated disc or even from a knee injury can indeed cause neuropathic pain. It is characterized by shocks, burning sensations, and tingling in areas where you would normally only feel a light touch when you run your hand over them. When you see a doctor, they talk about tendon transfer or ankle arthrodesis, but they simply ignore the fact that you have very intense pain, and that today, your priority might be to relieve the pain rather than improve strength. Therefore, if you have neuropathic pain that is extremely disabling, in addition to loss of strength, we need to treat both together. So how does the treatment for neuropathic pain work after a sciatic or fibular nerve injury? Well, the first step is to use medications for control, such as pregabalin, gabapentin, amitriptyline, and nortriptyline. In addition, muscle release, myofascial release, and stretching can also help. Furthermore, time also helps you. Of course, we're not going to just wait for years for this pain to improve, but after an accident, the pain is usually more intense than it is a few months later. And, in addition, surgery is also extremely effective for relieving this symptom, especially if you had an injury to a specific nerve, and we understand that there is compression there. I've had many cases where the patient had a sciatic nerve injury in the hip, and after a nerve decompression, they experienced an improvement in neuropathic pain. In these cases of severe injuries, we perform a tendon transfer along with nerve decompression to improve foot strength and also enhance quality of life by reducing pain. Tell me something, when you talk to your doctor about improving foot drop, did they consider doing anything to relieve your neuropathic pain? Let me know below, I want to hear from you. Have you noticed that there are very few videos online talking about neuropathic pain after an injury to the fibular or sciatic nerve? So, help me share more information by liking this video and following our channel.